The Health Ministry reported nearly 38% increase in the number of COVID-19 cases last week, following a reopening of school sessions in mid-March. We asked public health specialist Professor Dr. Sharifa Ezat if the rise in cases is something to be concerned about.
When we talk about endemicity, meaning that we are seeing more of the virus is everywhere in the community, but the impact of the virus or the virulence of the virus by right, it will not be very severe. It will present as mild or asymptomatic or with mild cases or categories, meaning category 1 and 2. These are youngsters. In a way, they are relatively well and young, meaning with good immune system, and these are also people who are or children or adolescents who are already protected through the immunizations, COVID immunizations that has been provided from last year till now. Our children are going through the prime vaccinations, and some of them has even received their boosters. So this will actually protect the children. So even though there's a whole bunch of new cases, this do not mean many things. This would just show that this is in concordance with other areas in other countries as well. You will see that the more people will get infected, but they'll present with less symptoms or less severe symptoms as well that do not require hospitalization and usually will not result in death. Now, what we need to be worried about are among the children or school-going children or adolescents are people or adolescents who are either immune compromised, either they have diabetic, insulin-dependent diabetes. They might be asthmatic. Some of them may be having cancer as well. They might be having handicap of certain degrees. They might have their spleen removed for certain reasons. So these are children or adolescents that may develop more severe categories if they get infected with COVID. So these are children or adolescents that need protection. The children or the schools must be, these students must be identified by the schools or the hostels where they are living, where they are mixing around with other students. They must be protected in a way that they must be advised to wear masks. They might have to be isolated for certain reasons. And if they get infected, in some cases, they might have to be referred for further observations and not just be spending their time in the hostel or in the school as in other normal immune children.